Good morning, good afternoon, good evening. I am so happy to be here. It's a Easter holiday for some people who celebrate it. Happy Easter to everyone who's celebrating Easter. We are here today with our part two of our discussion. I gave a little short introduction of this topic on the day of the World Bipolar Mood Disorder. And today we're going to take a deep dive and get on it. Before we do that, I'm going to introduce my two guests here. To my right, I have Honorable David Naboare. You know this face. He's one of our hosts. Hello, Honorable Dave. Honorable
Hello.
Dave is actually the national president of mental health officers in Ghana. He's also the CEO of Nabuare Foundation. He does a lot of good work in Ghana, and I can see he's expanding. I saw him working with Mexico, and he continues to fly. I'm so proud of him and the work he's doing in mental health. And of course, to his right, I have Miss Patience Aguiare, who is a senior health nurse or mental officer. He also does some wellness coaching outside her practice. And of course, he's also a rep facilitator. I was happy to see that. We need more rep facilitators in Africa. Welcome, Patience and Honorable Dave.
Thank you very much, and
Thank you.
good afternoon, evening, and good night, wherever you find yourself around the
Yes,
globe. Yes.
good to see you. Good to see you. Today, we're going to talk about a topic that I feel we need to discuss it extensively. You know, this week we are celebrating mental health, specifically bipolar mood disorder. I can see people are live with us here. Hello, welcome. Today we're going to talk about a topic that I feel each one of us, when we leave this space, we're going to be different in understanding it, and also the way we're going to view people who live with bipolar mood disorder. Mood disorders are a reality in people of African descent. It's not a white thing. You know, I know that a lot of times people believe that it's a white people's illness. No, it affects everyone. So these two speakers here, we're going to take a deep dive and get on it and understand who's at risk. How do you present when you have this? And of course, how do we treat this? Because it is treatable. You can live or lead a normal life. We have doctors, we have teachers, we have nurses, we have every people from all spectra who have bipolar mood disorders. The difference between them and people who don't have medication and the support, these people, they have the support they need. They take their medications and lead their lives. They are married, they have children, they lead normal lives. They have the same opportunities job-wise. And here, if you are here, you're an employer, you are a person who doesn't understand this illness today, you're going to leave this space changed and transformed so that you can give these people, if you have such people in your organization or company, give them the same opportunities. They are not crazy. Today, we're going to actually debunk all these terminologies we tend to use as Africans. Don't worry, today we're going to talk about this in depth, and all of us, we're going to leave transformed, and we'll leave this space going out there to support the friends, the colleagues, the family members who live with bipolar mood disorder. Like I said, people with bipolar mood disorder, they lead normal lives when they get the support they need. They have their medications. You as a family member or the spouse or a mother or a father or an uncle or an aunt, whoever looks after these people, because sometimes it can affect children. It's your paramount, or it should be your paramount priority to understand this illness. Open your heart to mental health workers or mental health professionals when they want to teach you this. Open your heart and understand it, because this is how you're going to live with this. It doesn't go away. It does not go away. So what I want us to take out of this discussion is it does not just go away. You're not going to pray over it. I know we tend to be big in prayers. I love that about us, but let's be realistic and let's go back to science and the proof of how do we deal with such an illness. I don't want to waste our time. You know what, Miss Patience, I want you to share with us here what you see in your practice. What is bipolar mood disorder?
Thank you for having me, and I want to use the opportunity to welcome all our listeners and our viewers around the globe. And we want to wish everyone the best the holidays. We hope our best to keep taking care of ourselves and staying safe.
Thank you.
So, coming back on your question on what bipolar disorder is, we understand that it is a mental health condition in which the individual experiences two different poles of the disorder, of the condition. And by that I mean the same individual who has been at some point in time, on one angle, experience low energies, and by low energies I mean they not being up to themselves as we know them to be, outgoing, outspoken, energetic, interactive, sociable, all the usual, signs that we see with a regular person in the society, community, school, or workplace. However, if an individual has been diagnosed with bipolar disorder, at one point you would find them not being the regular person we know them to be, which means they are experiencing one side of the condition which makes them less active, less engaging, less interactive. They show up to be withdrawn. They do not want to engage with people like they used to be. Sometimes it could be as simple as answering their phone calls, getting up to go and take a shower, dressing up, making up. And this part of the condition is known as the depressive phase. With that being said, the other part of the condition takes the individual on an elevated mood, which means that you find them showing up in a more, or for lack of a better word, we say overly energetic. They show up to be overly energetic. They are on the streams of everything else that they're experiencing during the depressive phase of the condition. And so with that being said, you find them engaging in, some activities that are not more healthy and supportive, such as they get on a spending spree, they become overly spending. Their spending increases. They could, if it's about talking or communication, they would talk more. You find them talking more or excessively compared to on regular day as you would see them too. So it's like all the other activities I described in the depressive phase, when they are in the hyperactive, or I do not like to use the word manic phase, but the high energetic phase, then they get to do more of those things, like whether it's in, they like to be outgoing, they like to go out more, spend more time with friends, and their energy is just so high during that phase. So the word bipolar is basically describing two poles. So the same person is experiencing two different forms or two different experiences of the condition. So on one pole, you find them to be sad, to be quiet, to be withdrawn, not wanting to engage with anybody. And then on the other side, you will find doing the extremes. It's like their energy is high and they are actually doing more or overly more of what they would rather do when they are sad or depressed. I hope
Thank you
this
so much,
explanation is
Patience.
supportive of our audience. Hopefully, we can David can add more to that.
Absolutely. Yes, yes. Thank you so much. That was a beautiful, beautiful description. And you know what? Like I said in the beginning of our conversation here, it is common in every culture and every race. It doesn't choose socioeconomic status. You know what, Honorable Dave, I would like you to take us through and just add to what Pat was saying. Who is at risk in your practice? What do you see? Who's at risk? And of course, according to studies, who's at risk of this? What are the risk factors? Over to you, sir.
Thank you very much. Before I come to who is at risk, I would always like our viewers and listeners to understand the concept of whatever we're doing. As Madam said, so bipolar as a condition is of concern to us. When I look at some statistics around the world, some of them I pull from World Health Organization says that about 44 million people are suffering from this condition. And looking at that, I went further to look at that part of the human brain that is implicated when someone has bipolar, because the human brain has various regions, various structures that perform specific functions at what point in time. So in bipolar, the prefrontal cortex is affected. The subcortical connections are also affected. Likewise, the amygdala is also affected in bipolar. So I want our listeners to know that we are not just speaking out of vacuum, but we are speaking back with science and research. And when you look at some of the material some of us pull and posted on platforms, research of bipolar has been done over decades, and the condition is with us. You were asking the risk factors. Yes. For this very form of mental illness, I will always say that there are a whole lot of things that happen to the individual. And we know in most of our mental illnesses, before you be able to come, most of them are being told. And the exact cause is not known, but there are some risk factors. So in bipolar, when I was also going through, we were also looking at some issues that actually can be connected to people having this very condition. And the biopsychosocial approach is very, should I say, implicated in this very issue. And when I say the biopsychosocial approach, the biological makeup of an individual is very, should I say, seen in persons who have bipolar disorder. What it means is that it talks about if you are born of a parent who have bipolar, your likelihood of getting bipolar is very, very high. Notwithstanding, when I was talking about these very things, I talk about the structures. We also have to look at the chemicals in the human brain. And those chemicals, the neurotransmitters and stuff, yes, one cannot talk without looking at what dopamine and stuff also do to us. And dopamine is one of the things that is well said, and it is also being said to also be implicated when it comes to bipolar. And let us also get it. When my dear guest was saying, she mentioned of the two poles. That is fine, but you could have clients that would be experiencing same both the low and the high at specific times. It also happens in some rare cases. So irrespective of the client in question also has issues of discussion. We also have psychological issues, and those psychological issues, we can take them from how we have issues regarding traumatic experiences, childhood, relationship problems, and so on and so forth. So you can see that before a trigger, probably you are prone to getting bipolar because you are coming from a family that has bipolar and you have a psychological problem, probably a divorce, probably you have lost your job. It is going to trigger the episode. So some of these things must be looked at. So you were mentioning that our job, should I say, our employers should be very key, because when it comes to that very area, sacking somebody is no problem. But let's look at the mental health implication, of which bipolar is very key. Madam also mentioned that some of these clients, when you look at their signs, some of them dress flamboyantly. Yes, some of the bipolar patients, you see them, they dress flamboyantly, extravagantly. Therefore, they are going to be spending at impulsive rates, and probably they have money they can spend until the money is finished. So we must look out for this. We also have sociocultural, our social belonging, the networking at times does not encourage and promote our unism and unity. And some of them, instead of us having a healthy relationship because of our social network, we are having unhealthy relationship because of the poor social network. And these things are risk factors that triggers some of these episodes. Because I know, dear President, will listen to me when I present my problem to you. Madam, I have this problem. I have been having low mood. I've been having high mood, and I don't know what is that. Then Madam just tell me, oh, David, what do you mean? Go away. I think this is one of the things. Probably you don't have money or anything. In fact, some of them, they feel they are not in any particular network of groupings, and it at times triggers them. So these are some of the things that we have to look at. And also, when you look at the emergence of mental illnesses, you always look at some of the conditions coming between the ages of 14 and 29. Bipolar also is also seen in those age brackets, of which when we are mentioning persons that commit suicide, yes, which is very key. Depression is very well said when we talk about persons who commit suicide. And when you look at bipolar, bipolar happens to come along with persons having low mood, which is depression, and persons having what? High mood, which is mania. So you can see that if a client happens to fall in the category of the low mood phase, most of them will be thinking of committing suicide. So most of our patients that commit suicide at the end of the day could be having bipolar disorder. So we must look out for that, and we know every 40 seconds someone commits suicide. So it is very necessary that we look at what is actually the fundamental issues that we want to arrive at. Be able to understand the mental health of our people. I have not come there. So some of these risk factors, if I want to continue, we'll continue. That is why it is necessary as a pregnant woman. At your ANC clinics, you must seek the professionals of midwife, so that when you are giving birth, you don't give birth with a traditional birth attendant who will not be able to attend to you, or who will not be able to handle, should I say, your baby well. We know some of these injuries that happen, that at times brings about these chemical imbalances and stuff. Some of them is as a result of these children falling on floor with their heads knocking on ground at birth, or probably they're having some kind of trauma at the end of the day as a result of accidents. So these issues are some of the things that actually brings about bipolar, of which you must know the chemical imbalances are very, very key when it comes to low and high. So when it is high, you are in a phase. When it is low, you are in a phase. So what brings about the high, we must know. What brings about the low, we must know. Therefore, we must look out for the causes of high mood, which is the mania, and low mood, which is the depression. Thereby, we'll be able to equate and be able to come out with what actually the issues are, of which I have mentioned. But notwithstanding, some of our clients could be showing some of these two distinct phases of this condition. Bipolar conditions are very rare, and it takes 1 year, 28% of us to tell our family members that we have mental illnesses, of which bipolar is included. So some of them could be having the challenge, but they will not tell their family members that they have bipolar. How will they even know that they have bipolar? It's about us telling them at our symposium what they're supposed to do. Like what Madam said, if you have low mood, at times you have high mood. Some of them, as he said, they cannot maintain a position at a time to do a specific thing. Yes, so, and the hypomanics, for instance, some of them, they will perform creditably well at job places. Whatever you give to them, they will execute, but they have problems. They will never finish execution of those projects at the end of the day. So we must look at what our employees do at various workplaces, and we'll be able to know whether somebody is having some signs of bipolar or not. So this is where I think I can pause now for us to still continue with our dialogue. And I think our viewers, wherever you find yourself today, it is an opportunity. People want to listen to us talk about bipolar. Today we are here. We are not just talking out of vacuum. I have been in the market space of mental health, especially handling mental illnesses, since 2015 up till now. So I have seen a lot when it comes to mental illness, especially at the community level where there is no specialist care. Some of us find ourselves there. So some of these things, we see it as frontliners when it comes to mental health professionals and practice. So it's about what we're supposed to do to help these families. I know the topic today is about people living with bipolar. So we will come to the psychosocial needs when I get there, what the family need to know. And at times, some of these people, we must look out for shared symptoms of some of these patients in their families, and we'll be able to know that their families at times look at them, oh, this one is okay because of what this person is doing. We must also toe that line and be behaving in that way. That is not the case. Let us look out for what the culture of the people prescribe before we'll be able to determine whether you have a mental problem or not. The culture of the people, the normalcy, what is practiced to be accepted as standards in that culture should be looked at. And thereby, when we look at those standards and they are deviating from the normalcy, they will be able to come out to say this person is having a problem. So when they are debating, which of the categorizations do we make out of this person's weird behavior he or she is putting? But more to the point, females also suffer. I think I have seen most females suffer from bipolar than males. I am still looking at the ratio as I am going about my research, and some of the figures I am getting, they are actually conflicting. So I don't want to actually commit myself, but for what I have been seeing and clients, I have seen more females having bipolar than males. But males too have bipolar. That is what I want our viewers to know. Thank you very much. And I know our viewers and listeners are watching us from across the world. And President, congratulations. Thank you very much.
Thank you so much, Dave. You know, you mentioned a lot of things, and I want us to be very practical. Like you said, we want to bring it right to the community, and looking at the stats and basically the commonality of this mental illness. Very common, of course, like you said, in the teenagers. I want us to pay attention to that, because this is a crucial age where the brain is developing. By the way, all of us, our brains have full development at the age of 25. So this is a very crucial time where, as communities, mental health workers, we need to get to the spaces where there's youth, the churches, the mosques, the schools. This is a crucial time to educate those spaces, because, like I said in the beginning, we Africans, we tend to pray over everything. Faith plays a role in our healing moments, but we still need to do what we need to do. So I want our viewers here to pay attention to that. So now our challenge is, how do we bring these services to the schools, to mosques, to churches, and educate these community leaders to understand this? Because unfortunately, now we are in the pandemic. We are seeing young people drawn into drugs. And like you said in the beginning, these symptoms could be triggered by things like stress and probably the drugs. Kids are starting to explore with other drugs. There's cannabis, there's many other drugs children are exploring right now. So it's very important for parents to pay attention to their children's behavior. How is your child behaving? Who is he or she hanging out with? All those things are very important, and not to be in denial, because unfortunately, bipolar mood disorder could also present with psychotic features, right? Most especially when there's a substance involved. Like I said, it could be cannabis, marijuana, basically, or other things. Miss Patience, tell me, in your community, how are you dealing with bipolar mood disorder? Do you have institutions to help our clients? And of course, I would like you to touch on how do we manage it, because I want people to realize this. Bipolar mood disorder is treatable. It is a treatable condition.
Thank you so much for this question. And I'm going to speak from the wellness and recovery perspective. The reason is that regardless of your symptoms, regardless of your experiences, it is possible from whatever health condition you may be experiencing. When
I lost Patience there. Dave, do you want to go ahead?
Yeah.
Can you touch on the management plan? We're going to get Patience back here.
So
thank you.
For the management plan, as you said, what I do here is that, first of all, clients' relations, clients themselves, those who actually have insight into their problems, can report to you that they are having A, B, C, D signs and symptoms. So some of them could come tell you that I have probably low mood, and most of the times too I get high, and these are the things we have to look out for. So when the person is having depression, there is a protocol of treatment in the community we provide. And when the person is having mania, there is a protocol of treatment that we provide. So during depressive phases, especially some of the episodes, that is what I'm saying, it depends on the kind of psychotherapy, the talk therapy you employ as a mental health professional. Some of them, when we engage them, probably we could be able to calm them in their situation, especially when they are high in terms of restrictions and stuff. But some, you actually need to give them some mass sedation, especially when they are high. And when you sedate them a little, they will be able to actually calm down. Yes. And there are available medications that we give them in terms of our standards of treatment. So for the benefit of our viewers and not going into much into the clinical practice, I think management of depression, we have a standard protocol. Management of mania, we have standard protocol. But when the two phases are there, then you need to actually be circumspect of the medication you use to be able to balance the mood of your client. So for me, those cases I have, most of them I do put them on oral medications, and I cannot do that on my own. I need to call a prescriber who is in the neighboring facility, and the person will also support me in terms of prescriptions. And some of them, they are quite doing well in terms of what we give them. And I can remember that some of the medications that we put them on, I think the available one the ministry brings, we have the risperidone that we do give some of them, and they are okay with it. So I don't want to talk much of psychopharmacology because it's a different issue, because most of us actually want to move away from the medication stuff to see how best we can handle this situation at the initial point, unless the patient is experiencing some psychotic symptoms, of which we know hallucinations and delusions could be present. So if those hallucinations and delusions are not present, we should be able, as Madam started, I know she will come in, to use some kind of psychotherapy and talk therapy to handle our clients Until that handling cannot, then you move. But some of these cases too, we have depressive emergencies. When they come, you have to actually intervene. And when we have the manic emergencies, when a client over 4 or 5 days is high, never eating, you have to actually bring the patient down, probably put him or her on some few infusions that could revitalize the system by providing nutrients, and also add some kind of sedative medications that will bring the person down a little. But to me in the community, what I prescribe is that upon letting my community know the signs and symptoms, it is better I see the client at initial point. Let's see the trigger. Let's work at the trigger. And some of them will tell you that, as you mentioned, that they are on substances. So when you are withdrawing them from substances, you know that they'll be having withdrawal symptoms. So we have to manage for the withdrawal symptoms with some mild medications, and they will be fine. So this is all that it's client specific though, but it is also being measured against standard protocols that we are guided. This is all that I can say for now. So I have seen a lot, and some are also doing well. Some do come, some even want to be ambassadors. Yes, so my call to some practitioners is that we shouldn't just rush and put our client on medications without probing further to look at some kind of signs and symptoms they are exhibiting, because some of them along the line, we know some of the conditions, especially as the mood keep swinging, you have to actually be circumspect in terms of somebody will say your assessment, clerking and stuff, so that you'll be able to be very sure whether the person is having a one phase which you can count that this is mania or this is depression, or the two are actually present. Thereby, you can move to the standard treatment protocol for bipolar treatment and put your client on that. So I'll pause here for our RAP specialists to continue. And I know they're doing a lot when it comes to that. Yes. So I think a time will come, most patients, as some of us have started, will not be put on medication, but the psychotherapy and stuff will work more better in terms of some of these conditions, especially bipolar, of which we know it's a hidden condition that people don't actually want to talk about, because they don't understand why the person is always having low mood, at times getting high, at times low, at times high. Some of the community members tag the person, that is how she is, or that is how he is. No, there is a problem somewhere. Let's find out the problem and work at the problem. Thank you very much.
I loved it. I love when you say we need to dig deeper. It's very important as practitioners, as health care practitioners generally. That's how we are trained. Take that history. History is very important. How we were trained is 80% of your diagnosis comes from your history, and then 20% will be your diagnostics, like your investigations. I've always used that protocol. It has helped me in my 15 years of practice. And of course, I want our viewers to realize that sometimes these symptoms are ongoing. If your child or your family member is experiencing these symptoms for a period of 7 days, you find that your child or your family member or your friend or your colleague has this behavior that is outside her normal or his normal behavior. It's lasting 7 days. Please find this person help, because he or she has no insight. He is or she's in that ill episode where he cannot make decisions for himself. So families, I know that Ms. Patience will tell us more about the support that these people need from their families is very important, because like I said, they are vulnerable at that moment. They need your judgment to make the best decisions for them. Ms. Patience, you back. Sis, tell us, how can we manage bipolar mood disorders?
Yes, so thank you. And as I was saying earlier on, um, it is possible to recover from any form of mental health experience. And I want to use this opportunity to let our viewers and listeners know that mental health challenges lives with us. It is something that we experience every day. So far as you are alive, you are navigating through this journey called life, you will experience one form of mental health challenge or the other. Now, it is not something that happens to other people and not us. The fact remains that our experiences, our, interpretations, our assessments of the things happening around us definitely informs or impacts on our feelings, our thoughts, and then our behavior. So again, as human beings, there is a common thread. We all have feelings, we all have thoughts, our thinking patterns, we all have behaviors. Now, whatever experiences you go through in life, the interpretation and the assessments you make of those situations and circumstances uniquely definitely impacts on what your feelings are going to be like, what your thoughts, what kind of thoughts are going to run through your mind, and then what behaviors. Remember, the way you feel impacts or informs the kind of thoughts that runs through your mind, and those thoughts will definitely shape your behavior. They will manifest into how you're behaving. And so again, for persons with bipolar disorder, or for persons with mental health challenges or experiences, managing them requires us to be very intentional in understanding what is actually influencing those behaviors, what is influencing those feelings, what is influencing those thoughts. Because then, if we are intentional and conscious around the very unique experiences that are shaping these feelings, these thoughts and behaviors, then we will be in a better position to support these individuals to live a meaningful life, to thrive and be able to achieve their goals as much as possible. Again, as David said, personally, in my almost 12 years practice as a clinician, I have always been against the idea that medication is the only way persons with mental health experiences can live a meaningful life. I do not fully support that ideology, because I believe that people are not their experiences. Life goes on beyond medications. Yes, some people will need medications to achieve a stable life, to achieve or to be grounded as far as living a meaningful life is concerned. But medication is just one part of the entire support that people need. Medication is just one, is an iota of the kind of support that persons with mental health experiences or bipolar disorder need in order to thrive and achieve their goals. Now, talking about managing them, we need to be intentional around language use. We need to be intentional around how we remind people of their experiences, those unfavorable experiences, those unsupportive, emotional, or traumatic circumstances that people have had to deal with. We need to be intentional in how we are bringing people to relive those unfavorable experiences. David talked about having to go through divorce, having to go through the loss of a loved one, having to lose a job, having to experience all manner of challenges as we navigate through life. And remember, do we not feel that each one of these experiences would definitely impact or affect how we are interacting with other people, how we are expressing, or how we are showing up in the world, how we are showing up in school, how we are showing up at work, how we are showing up in community life, or how we are showing up in wherever we find ourselves? Definitely it will. So then, if you and I are going to be supportive of persons with bipolar disorder or persons with mental health experiences, then we need to watch the language we use. We need to, if we are not able to do anything, the least we can do is to validate their unique experiences and understand that, hey, this individual have had their own challenges in life, and that has shaped who they are, that has shaped how they're showing up in life, that has shaped how they're talking, that has shaped how they are responding to your request or your needs or your presence, whatever the situation is. And so for me, it goes beyond medication. As I have said, it goes, what we need to do is to explore the individual's unique experiences. Now, here is a practical example that I've had to do in my practice. I nursed a 17-year-old boy who did not pass his senior secondary school exams. That is the West African Senior Secondary Certificate Examination. This boy had a dream of going to the medical school, all right? And they were a group of friends. Now, they all passed their exams. He didn't pass his exams. This is someone who has a dream to go to the medical school. Now he didn't pass his exams. He's brought now, because of the effect, the impact of not passing his exams, he starts withdrawing. He's isolating. He doesn't want to talk to his parents. He will lock himself in their room. He won't eat. He won't maintain his hygiene. He won't talk to anybody. Now, parents, not knowing what is happening, bring this boy to the psychiatric hospital. And the first point of intervention is to put him on medication. And now I'm like, no way. This boy does not need to be put on medication immediately. We need to explore what his experiences are. What is bringing about these behaviors that he's demonstrating? What is actually, causing him to isolate himself? What is it? And I had to take time, talk to him, share his experiences, his dreams, what is important to him, what is meaningful to him. And then we get to explore what other options are available. Now, not passing your exams does not mean that it is the end of the road for you. What options do you have? And I think that our orientation also does a lot of harm than good. The way we are brought up is like our mindset is so strict on achieving a particular goal, and once we do not see ourselves getting near it, it means that it's the end of the road. No, we need to explore options. We need to always look at the bigger picture. There are so many things we can do outside of our primary goal or what is most important to us. And so we had to explore. I explored with this a young gentleman. Now, apart from passing your exams to go to the medical school, what else are you passionate about? What else do you love to do? What else do you wish to see yourself doing? And here we are, we were able to explore other interests. So you realize that for persons with bipolar, for persons with mental health experiences, managing them requires us to explore what is meaningful to them, what is important to them. We need to have that patience. We need to have that understanding that, hey, this individual is unique. He or she is an expert on him or herself. And what may be important to me might not be important to them. And that is absolutely fine. We need to validate people's experiences. We need to keep an open mindset around what people's experiences have been and how these experiences are shaping their behavior, how these experiences are shaping their feelings and their thoughts. And I believe that when we do this, when we position ourselves, and as healthcare practitioners, we need to, assume the role of a peer rather than that of an expert. When you see yourself as an expert, it's like you are ordering your client, do this, this is what I think is good for you. No, we need to, come to that point of seeing ourselves as peers and be more supportive by being willing and open to explore the individual's unique experiences, understand what is shaping those experiences and how we can be supportive. That way, we will be less judgmental, we will be less prescriptive, we will be less, focusing on what is wrong rather than what is strong. I think that we need to come from a place of abundance, a place of love, a place of acceptance, where we are able to show up as, I understand you. I understand how you feel. It is okay to feel the way you feel. Your emotions, your experiences are valid, and it's okay. I'm here to listen. That way, we bring out the best in the individual, and trust me, they are able to maintain and sustain meaningful relationships. They are able to work productively and contribute to their society they are able to, engage in meaningful activities that supports them to thrive and be their whole best self. So that is, when you ask about managing, I think some of these things will go a long way to create a safe space and one that is an empowering environment to support people to be their whole best self regardless of their symptoms. And let me say this: recovery from mental health challenges does not mean complete remission of symptoms. Recovery comes in when the individual is able to take back control of their lives, is able to do things their way. We should look at recovery from the individual's perspective, not from our perspective. And so I believe that when we have this shift in, perspective around mental health, managing persons with mental health experiences, we will go a long way to create champions and bring out, the best in everybody. And together we'll make the world a better place. Thank you.
Oh my God. You just amplified what's in my heart. If I were to do this presentation, I would do exactly what you did here. And I know that some clinicians are still in that mindset: medication, medication, medication. It's like when you find someone who is depressed because he's hungry, give him food. Give him food, not an antidepressant. You know what I mean? So I honestly, this resonated with how I practice. I'm a very holistic type of person. And honestly, a lot of times, more especially young people, yes, there is a place for medication, but a lot of times, if we take time and listen, parents here, listen to your children, open communication lines. Your children need to be okay speaking to you with about anything that is challenging them. They are thriving. They are trying to be here. There's so many challenges out there. Nowadays, there's kids I'm treating with eating disorders, which could bring about depression. All right. So if we don't have the open communication lines with our kids, we're going to miss these things Patience was talking about. Thank you so much, sis. I loved it. I loved it. You know what? I don't want to take time from our viewers. I have I've made many comments for you guys. I'm going to take them because I know that they've already touched on medication and, of course, the other options we have. Why don't we take the comments? And then, of course, these comments will be directed to you guys. Thank you so much. I can see our viewers are still here. Thank you for being here. I have Dr. Marsha here say, research support many other treatments, including therapies such as DBT, basically. That's dialectical behavior therapy among men. Yes, absolutely, Doc. You are so right, right? And Kasadi says, I totally agree with everything this woman is saying. We must also be very careful not to judge people with mental illnesses or mental health issues. Thank you so much, Kasadi. You are so right. Kasadi just gave you a big applause here. You were amazing. Yes. So basically, this was just powerful. And I think once we start understanding mental health challenges or mental health illnesses, we're going to thrive and we're going to have these kids to lead normal lives and to be leaders. I loved it when you touched on the options, because I remember also studying at med schools, you are given an option. What else can you do? If you don't get into medical school, what other things are you interested in? That's very important. And I know sometimes that traditional way of parenting, where parents said, no, you're going to be a doctor, you're going to be a lawyer, that's it. It puts so much pressure on your child. And sometimes these symptoms are brought about by parents when we do not want to accept our kids' gifts. Your child could be probably gifted in art, in, all these things. Yes, it's okay to embrace education. I'm not here saying education is wrong. I love education. But we need to connect with our children where they are. What do they love? Embrace that. Give them tools to excel in that. Not many of us will be doctors. Not many of us will be nurses. Not many of us will be lawyers. There's so many other careers out there. We need all these children to tap into those spaces. I'm loving the fact that even girl children now, they are in STEM, science, right? Technology, engineering, mathematics. Back in the day, those careers were only for boy children, but today we are open-minded. We want our children to get into this. So honestly, parents out there, if you didn't hear Patience and Honorable Dave, you'll never hear again. Before we close, I would like each one of you here, I'll start with you, Dave. Give our viewers a word to take home to chew so that they can reminisce on what we just talked about here. Do you want to go ahead, Dave?
Yeah,
Thank you.
thank you very much. And God bless everyone, especially our host, Black Mental Health Matters, and the leadership of this very project. In fact, upon careful observation and happen to be someone who is much concerned about mental health illnesses, I think all that we have to do is that we should not stigmatize anybody with mental illness. We shouldn't stigmatize them. We should understand them in their own way. Because as Madam Pat said, when you understand the client's way, you're going to listen to him and be able to build the person's emotional resilience. Because if you are bringing your perspective, it will be very difficult for you to build the person's emotional resilience. But when you listen to the person, you'll be able to come out with some options to be able to help establish some kind of emotional resilience with the client, from the client, and it will be implemented by the client. Because whatever you do at that point in time, you will go. The implementation is with the client and the relatives. So I am saying that our parents out there, some of these challenges we are facing as young ones, they should look out for them. Our close relations, they'll be able to look out for some of these deviations and to report as early as possible for us to look at these situations. And our dear practitioners, as I said, I do not subscribe to we all the time putting our clients on medications. No, we should look out for other options rather than medications, because the options that you're going to look out for will help at the end of the day. So big ups to everybody. And from my point, I will say that we have done much when it comes to bipolar. We have talked to them on the signs and symptoms. We have talked to them on the options. If they still want to contact us, I think our president will have a link at the end of the day for them to contact us, those who have problems. And I think so far across the world, this is the best platform and the biggest ever platform that we talk about Black Mental Health Matters, where you always find persons who are interested in mental health, who are expertise, and who are advocates, who talk about the reality on ground, and who advocate and be able to uplift that your low mood. We want to come out from our slumber. We want you to understand that we are the architect of our lives. We want you to understand that you have a great future, even if you have a mental illness, and you can still be productive as you were even if you have a mental illness. Let us explore the options available. Let us look for the professionals. And I know at the end of the day, we are going to be serving a lot. Our churches, our mosques, our communities, the schools, and what have you, we are available for any collaboration whatsoever. And some of us have been going to schools and churches and stuff in our catchment. We even do online trainings. And I think I will be speaking with Madam Hens. We should engage the Christian Council so that we train some pastors in some of these things. We should engage our imams who are actually taking care of them, the assembly members, the politicians, the market women, our parents. Every parent should understand the mental health of his or her child. Thereby, when there's any deviation from the normalcy, you'll be able to know and seek professional help where you'll be listening to, and the child will make some kind of submission that will bring about solution to the problem at the end of the day. Thank you very much. Until we talk another time, today is 3rd of April 2021, and we are in the mood of Easter. When you are celebrating, celebrate consciously. When you are enjoying, enjoy consciously. Don't drag. In fact, the youth of today, don't drag. Don't speed drive. Your life is important to us. And we wish you very fruitful celebration. When you enjoy, remember to sponsor and support Black Mental Health Matters. We need your sponsorship to be able to do a lot of stuff across the globe. And congratulations, Madam President. I have not seen a very strong woman like your time. In fact, I thought I was not until I met you. In fact, you are too much. You are too much, Madam. God bless you. God bless you. So until we talk another time, big ups to all our viewers and listeners. Thank you very much. Congratulations.
You are awesome. Thank you so much, Dave. You are just one of my favorite humans because of how passionate you are with the work you do. It's showing in the results, the stuff you are doing out there. I'm just amazed at how influential you are and also how you are standing by the principles that you practice yourself in your family. We've seen you sharing your personal story. It's just beautiful to watch you grow. Thank you. And of course, before we get to Madam Patience, I actually realized that we had other comments here. Black Skin said, peace to the family. Thank you so much, Black Skin. And Fofana said, what causes stroke? Hamid, for now, residing in Sierra Leone. You know what? We're going to actually discuss stroke and also its implications on mental health. Thank you so much for that topic. We'll definitely get on it sometime here soon. Dan was inviting people there. And of course, Dr. Masha says it's important to provide psychoeducation to educate families and the individuals of this disorder. Some may believe that the person is behaving this way purposefully, but like you said, it's an organic issue. Thank you so much, Doc. You are right, right? Education is key, especially in cultures and communities that are just unaware. Yes, that's what we are about with the Black Mental Health Matters. We are reaching global community. If you are here, please invite more families, friends, colleagues, so that we can grow all together here. We are about to shift the world. And of course, one of the LinkedIn users said, yes, very important information. It's also very important that people receive the correct diagnosis. Black people across the diaspora are often misdiagnosed. That's a topic for another day, LinkedIn user. You are so right. There's so many things we need to unpack. And I would love to engage Dr. Marsha on that. We've talked about it. So much needs to be done in the education system. Thank you for saying that. And yes, Dr. Marsha is agreeing. Yes, often misdiagnosed. She sees this in her practice all the time. Dr. Marsha says lithium used to be the go-to psychotropic medication for bipolar. Thank you. And there's so many more, guys. Lithium, yes, is part of medication. There's also other drugs. We didn't really want to mention drugs here because we are not a diagnostic platform. We are here to educate. Kasati says, many mental illnesses are spiritual based and need healing from traditional healers. Praying to a white God cannot help. I have had spiritual work from Dogon priest for my daughter in the UK, who was psychotic and using many pharmaceutical drugs, illicit drugs, and alcohol for her mental health issues. Since having the spiritual work, she has stopped using those things. Also, talk therapy and herbal remedies are better than pharmaceutical drugs. Wow. Kasati, it's interesting you mentioning that. I had a discussion here, I think 2 weeks ago with Dr. Kevin Washington and Daniel. We talked about how do we bring healing to our people with the approaches of what they understand. There's room to coordinate and integrate these things. And I think, like we said in the past, we need to do more research because at the end of the day, we want to use safety measures. We don't want to just indulge in all these things, both the conventional medicine and traditional. We want balance here. We're not disputing that. And thank God your daughter is healed and is doing well now. God bless. I'm so proud of you to have done more for your child. And then another LinkedIn user says, wonderfully put, we are all experiencing life. Yes, agreeing with patients. And person-centered care is very important, absolutely. And of course, yes, Dr. Marsha mentioned the DBT, amongst many other. Thank you so much. I am so happy to have done this with you. I'm gonna hand over to Patience to give our viewers some few tips to take home before we close.
Thank you so much. I want to use this opportunity to reach out to my fellow clinicians and healthcare practitioners to understand that there is no joy in labeling people without exploring what their unique experiences have been or continue to be. It is important that we look at the person from a holistic point of view where we are taking into consideration, you know,
I lost Patience there. Absolutely. I always say this as healthcare professionals, we want to show up in the manner that we would love to be treated. It's a principle. Treat people the way you would like to be treated. If you need to spend time and take that history and show up in the manner that client is showing up to you by listening to her or listening to him, it will change the world. It will change, or it shifts everything. When we listen more, results or better results is what we are aiming for. But when we talk, sometimes because of stress, because of how many people we need to see on queue, we tend to miss these little things. And those are the fundamentals. Those are the fundamentals that we could miss or misdiagnose a person. There's so many people that are carrying diagnosis that was misdiagnosed, that was done in 2 minutes. It's unfair to have such a diagnosis on anyone's file. These diagnostics stay on anyone's file. So let's be careful and be mindful when we listen to those histories. Let's listen with compassion and full awareness and be mindful. If you are not sure of the diagnosis, collaborate with other healthcare workers. This is not just one consult thing. Diagnosis in mental health changes, right? Sometimes it could just present as substance induced psychosis. And to find out when you take that history, well, there is a family history of schizophrenia here. This was just triggered by the substance. So things change, things evolve in mental health. And also, I can't overemphasize, read, attend conferences, get yourself up to date when it comes to your literature. It's fundamental for any field. You got to be up to date with your literature. You can't use whatever was used in 1980. Things are changing. DSM-5 is adding more and more diagnostics. There's so many things that are changing right now. So you need to be up to date with your literature. Again, I'm going to let Miss Patience to finish because we need to finish up. And
yes.
end this. We're going to meet again next week. Go ahead, sis.
Right. So thank you once again. I'm calling on my fellow healthcare practitioners and clinicians to give ourselves permission and come from, a recovery focused approach with caring for our clients and supporting them. Now, a recovery focused approach is one that would focus more on the strengths and unique capabilities of the individual rather than the deficits, the deficiencies. We do not need to focus on what is not working. The idea is to focus on the strengths that these individuals have, build on those strengths, and engage them, encourage them, empower them to be their whole best self. Trust me, I have cared for several people who are living life meaningfully because they had somebody to listen. They had somebody to validate their experiences. They had somebody who was intentional with what language is being used, what is being said to them, you know. And so again, as healthcare practitioners, as clinicians, we can do a lot more to support persons with mental health experiences or persons living with bipolar disorder. And the fact remains that when we see and think differently, we act differently and get different results. We can't continue doing the same things and expect to have different results. No. So if we want to see our clients, you know, taking up job roles, being able to keep up with responsibilities, being able to contribute to, you know, their country, contribute to the society, we need to be that light that will shine in their lives by being mindful of how we are showing up for them, how we are being available to support them in our language, in our actions, in how we are engaging with them. So again, I want to say that if you or anybody you know has bipolar disorder or has any form of mental health experiences, please, you are not alone. I want you to know that you are not alone. You are important. You are loved. You are cared for, and help is available. Please reach out. I am here. I'm here to listen. I'm here to support you. We are all here. There are hundreds, thousands of and thousands of people around the globe you can reach out to. Please talk about your unique experiences. There is always that one person to listen. There's always that one person to show up for you. Don't keep quiet and suffer in silence. Reach out for help because help is available. You will only get the help you need if you reach out. So please, don't keep things to yourself. If you're having difficulty focusing, you're having difficulty, you know, working through life, making decisions, those are the minor challenges that we go through. So please reach out for support. Help is available. We are all here. And to our parents, please, we should pay attention to our children. Everything your child says is important. Please let us not dismiss the children and everything that they say. When your child is talking, please make time and listen to them. We are so busy chasing after the money, chasing after the promotions, and these children lack that emotional bond, the opportunity to connect with us emotionally so they can feel empowered to be assertive, to show up with their social skills and be able to face the world. And so they grow up struggling. Imagine that 50% of all mental health experiences start by age 14. This is very heartbreaking because for a child of 14 years to already start struggling with their mental health is an issue. We need to be mindful. We need to pay attention to the children. Please, they also have feelings. They also have thoughts. They have behaviors. Don't say that he or she is a child, and so you are dismissing the actions, the expressions that they are making. It is important, please, so that we can have a world that is filled with young adults who are able to manage their emotions. Thank you so much. We hope this discussion has been useful. We look forward to engaging with you soon. Enjoy the season.